Chemotherapy wasn't going to help.
From the outside, it's making agony to prolong agony.
What hit me was the probability of being alone and having the end to our adventure.
The doctor's prognosis really didn't leave us with any hope. We didn't see a future that included her.
And the doctor at Dana-Farber said that I would need 6 months of chemotherapy weekly. People had not lived more than about 3 years with this. And that's even with the chemotherapy.
It was about as grim a choice as could come up.
And I said to Pete, you know, I'm not going to do that.
Joyce and Pete Forsythe were making the most of their retirement in Dover, New Hampshire, sailing and spending time with their family. But their golden years came to a jarring halt when Joyce was diagnosed with stage 4 mantle cell non-Hodgkins lymphoma. Her doctor had never seen a patient with this form of lymphoma live beyond 3 years. But Joyce was not ready to accept that fate. Her cure would not be found in a doctor's office. She would find it at a farmer's market.
I was born in Pennsylvania. My parents ended up in Michigan.
Joyce and I met in student government in high school.
Married a year out of high school at the end of our first year of college, and worked like dogs. In 1959, we both finished undergraduate school.
Started our family almost immediately, gave birth to 2 kids and adopted 3 more, and ended up with a house full.
When our children were in grade school, junior high, I decided to go back to school and earned a master in social work and became a family therapist. And we got very involved, starting adoption parent groups and challenging the adoption agencies.
We were able to get some laws passed and some regulations changed and some people changed, trying to make sure that children who were waiting for families got them as quickly as possible.
Joyce and Pete had been landlords since college. Over the years, their rental properties grew into a thriving business.
When we turned about 55, I had decided, after that many years of working on apartment houses, by then we had 30 apartments in 11 multifamily buildings, and we rented mostly to students. And I decided I've had enough. So I talked Pete into selling the houses, and that freed us to go to Florida for winters. Because of my cleaning of all those college students' ovens at the end of the year in our rental properties, without a mask, without gloves, I was asking for trouble.
Joyce had been interested in nutrition from an early age, and she didn't hesitate to share dietary advice with her family.
My health was always very good. I never missed a day of school. My mother always gave me cod liver oil with my breakfast.
Mom did try to keep it quite healthy growing up. She went on this health food nutritionist kick, at which case our diet changed dramatically. No white rice, always brown rice. No soda, limited desserts.
Lots of protein, very little carbohydrate, and I ate that way, and I felt like steel.
Joyce and Pete enjoyed their active lifestyle. They loved art and developed quite a collection through the years. They were involved in various organizations and split their time between New Hampshire and Florida. For the Forsythes, this was the storybook retirement they'd always pictured.
In July of 2005, I was lying in bed watching a TV program, and I noticed one side of my belly button was firmer than the other side.
I remember very, very distinctly when she said, "Pete, put your hand over here and feel this." The change was dramatic. I mean, it was virtually half of her abdomen. As laypeople, we know the word tumor, and that came to mind.
I've always been so healthy, and I was feeling so good, so much energy, that I didn't think that it could be anything very serious. Went to my internist for my regular physical. A healthy person, I thought. She pressed and she said, "Oh my gosh."
She had an extremely firm mass over on the left side, and it was pretty scary for me to see it there after all these years of seeing her, very well woman with absolutely no problem.
The next morning, I was at the cancer center.
Forsythe were making the most of their retirement years. They were physically fit, doting grandparents, and had varied passions and interests. Then Joyce discovered a dense mass in her abdomen. Her doctor immediately scheduled an appointment for her at a cancer center.
When I got to the cancer center, they examined me again and said that I would need a CAT scan, a PET scan, plus many blood tests that were sent to many other states.
I was hoping it may have been a diverticular mass that had just collected together and was very firm and palpable. I was worried it might be ovarian cancer. We did an imaging study to see what was going on in her abdomen and saw it right away. The spleen was just so large and so firm, there was not a big liver or any reason to think it was anything other than a mass of some sort.
And the spleen is so vascular, you can't do a biopsy without getting out of the body. So I then went down to the Dana-Farber Cancer Institute in Boston.
The doctors in Boston wanted the spleen out so they could confirm absolutely what kind of problem it was.
And from there, she went to surgery.
When the spleen came out, I was told that it was a football size and weighed 5 pounds.
Typical spleen is barely, if at all, palpable on your usual abdominal exam. The size of a small fruit, perhaps a plum.
The spleen's primary function is to act as a filter for the blood. It removes old red blood cells, stores the useful iron, and ultimately returns that iron to the bone marrow. The spleen also plays an important part in our immune system, helping the body stave off harmful bacteria.
After her surgery, the spleen was looked at under pathology, and between that and through testing of her blood, they decided that it was a type of lymphoma.
Mantle cell non-Hodgkins lymphoma.
I could tell both by his words and his demeanor that it was not the choice he had hoped to find in the testing, that it was about as grim a choice as could come up.
People had not lived more than about 3 years with this.
The oncologist said, this is basically not curable, but we think we can give you a couple, 3 years.
As I recall it, my father and I were outside gardening, and he mentioned that they had diagnosed cancer, and I remember him saying that this would be what would end her life, and it was a very devastating moment for me. She had always seemed like she would always be there. I never thought about that there could be an end to her presence in my life.
We've been married a long time and have had lots of adventures, and part of me said, well, okay, here's another adventure, but part of me just sort of was knocked back and said, this could be the final adventure.
Joyce was still reeling over her prognosis when the oncologist outlined his recommended treatment protocol.
And the doctor at Dana-Farber said that I would need 6 months of chemotherapy weekly, of 4 different chemo drugs.
3 of the 4 had some track record, and the track record was not very good. They had in the bunch a trial drug, which of course nobody knows what it will do.
Some of the expected reactions, side effects, were mouth sores, loss of hair, nausea.
I've seen a reaction to the nausea with pregnancies and with anesthesia for other things, and I didn't want to live with her and perennial nausea either, because those are just a very compromised quality of life.
And they said it repeatedly to me, that the chemo will not cure your cancer. If it did go into remission for a while, it would come back and I'd have to keep taking chemotherapy. And I said to Pete, I'm not going to do that.
Years earlier, Joyce had been captivated by a radio program featuring Dr. Max Gerson, who claimed his naturopathic Gerson therapy could cure cancer, tuberculosis, and other chronic degenerative diseases.
I subscribed to the Gerson newsletter very early on and thought, if I ever hear the word cancer, I am switching immediately to Gerson. All our kids were very worried about my not doing what the doctor wanted me to do.
And I remember thinking, this is a doctor that died half a century ago, and that medicine must have made some progress since then. I was very concerned about her choice.
He didn't want me to take that chance, and he said he didn't want to lose me.
I knew once she had her mind made up, there wasn't any talking her out of it. And much as her presence or absence would affect me enormously as her spouse, this was the kind of thing I knew she was going to have to make the choice about.
She needed to do what she wanted to do. I had no doubt she would not choose chemotherapy. She talked badly about it for years.
The doctor said, well, nutrition won't hurt you, but it's not going to help. This is serious. This is stage 4.
Joyce Forsythe had stage 4 mantle cell non-Hodgkins lymphoma. Her doctor had never heard of a patient living longer than 3 years with this form of cancer under any treatment. The prospect of chemotherapy, along with its side effects, was something Joyce did not want to face. She recalled hearing about Gerson therapy, a naturopathic treatment that its founder, Dr. Max Gerson, claimed could cure cancer.
I was very surprised that Joyce was going to take an alternative approach to treating this cancer. And then when she told me about the Gerson program, I had never heard of it, but she was extremely committed to it, believed in it, and made some radical changes in the way she lived.
Dr. Gerson had said, if you feed your body what it needs, it heals itself.
It simply made a lot of sense to me. You try to make your body as strong as you possibly can with the best nutrients, help your body do its best, get rid of the toxics so that you have as few hindrances and as many helps with your body's strength.
I began reading very carefully Charlotte Gerson's book as to what to do every hour of the day.
It's very work intensive. Everything has to be fresh, everything has to be freshly made, organic. You can't get any cans, you must not use any cans and frozen foods and pickles and preserves and bottled foods. And so everything is worked from scratch. So it's a great deal of work. And of course, it's all very carefully outlined in the book so that you can follow the book and do it.
I thought, I've got to get everything round up. I need a juicer. I need to start bringing in the produce. And so I began right away doing that.
She said she needed a juicer and that can we find it online. We stayed up till 2 in the morning to make sure that we won the bid, and then she juiced.
She went from a meat-based, high-protein diet to a cancer diet, or the Gerson Program.
One of the things that Dr. Gerson's program does is to take a look at the acid-alkaline balance. When I went in to the internist for my physical, my pH was 5, extremely acid. The Gerson therapy keeps a patient very busy.
There's so much to do. It requires a strong dedication, both emotionally, I think, and physically.
It is by no means easy. There's many, many details and lots of do's and don'ts, and it's extremely work intensive.
It requires 13 glasses of freshly squeezed carrot and green juices. So that's every hour for 13 hours.
My job was to make the juices. You've got to get organic, fresh produce, and this means almost daily. And I found that you can buy organic carrots in 25-pound bags if you're willing to have the cashier ask you if you're buying them for a horse. And so each time I would do that, and some cashier would say, have you got a horse? I'd say, no, this is for my wife.
You grind the produce and then you press it.
If it doesn't work right, then the juice squirts out the back, or the cloth breaks, or, there are a number of things you get used to. Sometimes there's juice on the floor, sometimes it's on the ceiling. We would sometimes make a carrot juice, and then we would make a carrot and apple, and then we would take whatever greens she had brought or I had brought from home, kale or a romaine lettuce, chard, asparagus, you name it.
Now these juices flush out the toxins from the kidneys. They flush out the toxins that accumulate, and once the tissues release those toxins, they go into the bloodstream And the bloodstream filters them out by the liver. The liver filters them out.
The other part were coffee enemas, 5 a day, and I made sure that I got all those things that were required in. The coffee enema is to detoxify the body.
In addition to its strict juicing regimen and coffee enemas, Gerson therapy includes heavy supplementation of vitamin C, B3, and pancreatin enzymes. Joyce also eliminated salt from her diet and drank only distilled water.
Joyce took care of cooking her Hippocrates soup, which is another part of it. It's basically a vegetable soup. And both of us tried to watch to make sure she didn't have meat, she didn't have pastas, pushing her towards the vegetarian side and the juice side in order to get her pH up into a slightly alkaline level, which would greatly retard the possible growth of any cancer cells.
I didn't need to be taught how to do those things. I'm very capable. If I want a couch recovered, I can recover the couch. If I want the house painted, I'll repaint the house. And if I want to save my life, I can do Gerson therapy.
One of the great appeals to me about Gerson was there isn't any mumbo jumbo. There's nobody making a whole ton of money out of it. There's nobody claiming to have a magic bullet. It's simply, here's a human body, and if we can help it do its best, we have a track record of overcoming the symptoms of these diseases. There is no secret.
And Dr. Gerson had said it takes about 18 months to 2 years to cure cancer, and I was in for the long haul.
Joyce began feeling better. She went in for regular blood tests and scans to monitor her progress.
I was watching, and she was watching, to see what would happen to the numbers. And as we began to get blood tests back,
I went in with the blood tests and the most recent CAT scan and showed them to him.
I heard the doctor saying, you know, this is fantastic, this is terrific, your blood work is fine.
And it wasn't very long before they said, we can't find anything. And the doctor said, keep doing what you're doing. The chemotherapy would not have cured your cancer anyway.
Instead of the chemotherapy her doctors recommended, Joyce Forsythe chose the little-known nutrition-based Gerson therapy to treat her stage 4 cancer. This bold decision confounded the doctors, as did the test results, which showed her cancer had disappeared. Joyce's oncologist told her to keep doing what she had been doing and admitted the chemotherapy would not have cured her cancer.
If Mom had taken the chemo, she'd be gone. She wouldn't have survived. They gave her 2 years max with the chemo. And that was 5 years ago.
She could have had a very bad infection and died from the infection as a result of the chemotherapy. She could have been left with many toxicities, nerve damage, mental status damage, not being as clear thinking. Certainly are long-term effects of chemotherapy that are well documented.
They came in small increments. Each report was a reaffirmation of the fact that this was a successful direction.
The years that she was on this Gerson treatment, directly after she started, there was quite a profound change. She looked like a different woman after a year. She had lost so much weight, but didn't look sickly.
She's a good inspiration for a healthy diet and a way to live your life.
My hopes is that she continues with her healthy way of living because it really has done a lot for her, clearly.
I had the best of doctors, and I was at very fine hospitals. You can't beat them. Yet I chose not to do that because there was another way that gave me more hope.
She believed it could help, and it did, so that the stage 4 was essentially reversed and eliminated.
I would say she's in excellent health for any 73-year-old. She looks great, she's very active, she has high energy, her mental state is perfect, and she's always been very positive through this whole ordeal.
I think there are some people who figure I must have been misdiagnosed, that it couldn't have been stage 4 and been as bad as it was.
Joyce's commitment to follow her own instincts played a vital role in her recovery.
One of the things that happens when you discover you have cancer or another degenerative disease, it wakes you up to the fact that it's very important to eat the right thing.
With the Gerson therapy, with the right food, with the right nutrition, with a good detoxifying, nobody needs to suffer, nobody needs to be ill, nobody needs to die of these particular problems.
One of my doctors said, you could be a poster child for how a woman of 74 ought to eat. I want people to not just do what I say, but take a serious look at this, that there are alternatives.
One of the images that always comes in my mind when I think of Joyce is the dog that's grabbed a hold of something and then just going to shake it till it finally submits. She's a tough old bird, there's no question about it. She's committed and focused on what she wants to do, and you better get out of the way.
I'm going to cherish each day, and I don't want to do things that are dangerous because I've looked death in the eyes.
I think she's in better general health than she was 5 years ago. As a part of this new lease on life together, if you will, nothing is inhibiting our togetherness and our enjoyment as a result of this bout with cancer.
Joyce and Pete are grateful to the late Dr. Max Gerson, his daughter Charlotte, and the work of the Gerson Institute. She credits them for saving her life. And although Joyce no longer needs to follow a strict Gerson diet, she is a regular contributor